Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, if you see the next type in the duodenal ulcer treatment, the next type of vagotomy is the vagotomy and drainage. So, if you do in the vagotomy and drainage, we do a truncal vagotomy. In the truncal vagotomy, actually, if this is the stomach, we have the right vagus and the left vagus. So, both these vagus are cut at the trunk itself. So, here you are cutting the truncal vagotomy. So here the hepatic branch is lost, this branch to the celiac plexus is lost, nerve to lethargate is lost, even the parietal branches are also lost. So truncal vagotomy is performed in vagotomy and drainage. Here we do division of right and left vagus are divided or cut above the hepatic branches and the ciliary branches, that is, it is cut just above the gastroesophageal junction. So we cut this or we resect it just above the gastroesophageal junction. Okay, now if you see this, vagotomy and drainage is the most common operation which is performed for duodenal ulcer. So this is the most common operation which is performed for duodenal ulcer. It has an immediate morbidity rate and it also has a recurrence rate. It has an intermediate morbidity rate and it has an intermediate recurrence rate.
thank you and thank you for watching.